Senator Murray.
Thank you very much, Mr. Chairman, for having this hearing. Thank you all for being here. There is no question that our service members deserve a seamless transition out of the military to VA services. In my home state of Washington, DoD went live with its own electronic health records program back in 2017. It has its own challenges, and I'm sure you all know that when the VA rolled out its EHR program, it was not working the way that it should have, and patient safety has been a very big concern. So I want to make sure that DoD is working hand in hand with VA so that we can truly have a seamless electronic health record system that is available across both agencies to serve service members and veterans alike. Mr. Vazzarini, I wanted to ask you, can you share some of the lessons DoD has learned while you rolled out your EHR system, and how did you earn back the trust with providers and service members after you had significant periods of system downtime?
Senator, thank you for that. As we've rolled out our EHR, the things that we learned, and particularly through that first time period, the things that we, the barriers that we had in utilization, we've learned about what we need to do from a usability standpoint to make the EHR more usable for the healthcare provider. We've learned about the training that we need to conduct to ensure that there's a quick ramp up on utilization. And those are some of the things and some of the lessons that we've learned that we shared with our VA partners.
Okay, I appreciate that. I wanted to ask you about women service members because transitioning out of the military is a challenging experience for all service members, but it is particularly difficult for women who face additional barriers in the civilian world, everything from gender pay caps to sexual harassment, lack of access to child care. And there was a study by Syracuse University that 54% of women veterans who left the service didn't feel prepared to navigate the resources available to them in their local communities. That's compared to 35% of male veterans. Mr. Vazzarini, has DOT tailored the Transition Assistance Program at all for women service members?
Senator, we have, and so one of the things that we do through that transition process, and particularly in that understanding what benefits are available and the care, we've tailored particularly the education around health benefits and how to access health benefits for women. The other thing that we continue to do is focusing on all veterans, but particularly for women, is to understand for those who may have come across or encountered something along the spectrum of harm, the resources available to them there. So I'll turn to maybe Mr. Jacobson. He could talk about what VA would.
Yeah, Senator, we have what's called the Women's Health Transition Training Program, which provides tailored support and information for transitioning service members. It includes gender-specific health care information as well as information about how to access benefits in a timely way. What I would say is it is underutilized. So we're working to try to get the word out and promote and encourage more transitioning service members to take it because we do think it's a valuable resource.
Okay, thank you. And one last question. In last year's Military Family Support Programming Survey, 80% of the respondents said their finances were a major source of stress, and more than half of military and veteran families reported experiencing barriers to savings over the previous 2 years. 22% of currently serving military families, 38% of veterans families have less than $500 or no emergency savings at all. I think financial literacy is critically important, and Mr. Vazzarini, in my few seconds that I have left, what is DoD doing right now to promote financial literacy and making sure that that is an integral part of the Transition Assistance Program?
Senator, one of the things we do is from the very outset, from the time a service member starts in boot camp, is making sure they understand what financial readiness resources are available to them. We provide education and training and coaching and access to personal financial counselors throughout their time in service.
Okay, and if I can get a more detailed response from you, I would really appreciate that. Thank you, Mr. Chairman.
Yep.